Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to offer ways to accommodate a chest exam for individuals who need special assistance. Individuals with intellectual or developmental disability, often called IDD, may experience anxiety at the doctor related to unfamiliarity with the situation or previous experiences with difficult medical encounters. Lack of cooperation may be related to anxiety and can create challenges in examining some patients. First, consider how to best communicate. Verify potential differences in receptive and expressive language skills. Acknowledge accompanying caregivers and verify their roles. Key points in communication are explain and demonstrate, speak and move slowly, use comforting language to praise cooperation, take 5 to 10 second breaks when needed, and re-explain using visual tools if needed. Begin with an explanation of the planned exam. Seek consent or assent. If there is hesitancy, demonstrate on a caregiver, a doll, a stuffed animal, or use a picture. Ask about potential aids you may use for either distraction or incentive to ease and complete the exam. For example, a snack, a toy, use of screen time might help. First, then language can also be helpful. For example, once we have done your exam, then you can have this sticker. If the person appears to have difficulty, allow a brief 5 to 10 second break within the exam to help the person take a deep breath and relax. Help your patient get ready. Consider whether she can adjust her clothes or put on a gown. Consider if she needs help getting into position on the exam table. Before listening, explain that you will touch her with your stethoscope and listen to different parts of the chest. It can be helpful to demonstrate with your finger where you will touch. Some patients might want to help with a hand on the stethoscope to feel a little more in control. Allow them to place the bell on the chest wall themselves when possible. Now proceed to the exam. Touch the back with your stethoscope while you listen to breathing. Ask the patient to take deep breaths in and out. You may need to demonstrate how to take deep breaths. You may ask the patient to pretend that they are blowing out a candle. To examine the heart, ask the patient to lay down if they are able. Maintain a comforting conversation while you do the exam. Maintain the patient's sense of privacy as much as possible. If you meet resistance, pause and re-explain, then make a plan for what might work for this patient. Consider using an example, showing the next step on someone else, a doll, a picture. Then ask if you can try again. If the individual allows an attempt, praise their cooperation and offer an incentive as previously agreed. If using the exam table is not feasible, consider how to alter your approach. Some individuals will allow you to sit next to them in a chair, or hug them, or stand and dance or move with them while you listen. It is generally recommended that clinicians should avoid forcing any part of an exam. If there is an emergency reason for the exam, sedation may become necessary. When you have finished your exam, praise your patient for cooperation and offer an incentive that was already agreed upon. After this, discuss your findings and recommendations with the individual and caregiver, using simple language and providing time for them to ask any additional questions. Thank you for watching. To assist your patients in preparing for the chest exam, you can refer them to the partner video at 4rhealth.org. Thanks.